Miscarriages are devastating. They are not easy to deal with. They are not easy to go through. In most cases, it had nothing to do with you, mom. Hello, everyone. Dr. Aisha Rush here again with another installment of information. Hopefully that will be helpful to someone at some point. One of the topics that a friend of mine who is a fellow OBGYN wanted me to talk about is miscarriage. A good number of pregnancies, up to even 30% of pregnancies, sometimes can end in miscarriage. And a lot of women often, will look and blame themselves for it. Most don't even know the reason, interestingly enough. And a lot of times we can't really even tell them the reason because most of the reasons are often unknown. But when we go and research was done and looking at these pregnancies, what was found during that research was that many of the problems that occurred were genetic. And the miscarriage was nature's way of being able to take care of the pregnancy before, mom ends up with a not so good baby. So I want all you women, not most, all women to know that miscarriages are devastating. They are not easy to deal with. They are not easy to go through. And sometimes if you are struggling, or some women, who do struggle, I recommend that they do speak with their OBGYN about, mental health providers if that's needed, because sometimes it can be overwhelming, especially when these pregnancies are very much wanted. But again, most often we don't know the reason for miscarriages. And for a lot of women, I often have to tell them this has nothing to do with you. It could have just been nature's way of taking care of something that could have ended up bad in the end. And I want all of you to know that. Now, are there certain maternal conditions that can potentially lead to miscarriages? Sure. There are medications, there are substance use, disorders that people have that may put them in a position to have miscarriages. Things like maternal obesity can lead to higher risk for miscarriage. It can also lead to higher risk for things like stillbirth. So there are conditions like that. Of course, uncontrolled hypertension, not necessarily one of the bigger things that can lead to miscarriage, but one thing we always want to be careful of is because when we have hypertension, the placenta is how the baby gets its nutrients from mom. And if there's a high pressure system that is not allowing those nutrients to get to that placenta, then we, may end up with pregnancies that are in trouble. And, uncontrolled, very high maternal blood pressure can lead to abruption. It can lead to stillbirth. I've had a woman one time come in and pretty much hypertensive crisis. Basically, baby didn't make it because more than likely that placenta just couldn't perfuse and baby wasn't getting the nutrients, just to put it simply. So I won't go into all of the maternal conditions that can, increase your risk of stillbirth, because we'd be talking and having this discussion all day about those things. And some of these things are sort of not concrete and etched in stone and can be, controversial in terms of how you want to think about them in terms of how relevant they are as a maternal condition to cause miscarriage. But the most important thing that I wanted to convey in this video here is that I want you to understand that in most cases, it had nothing to do with you, mom. It did not have anything to do with you. And again, most often these may have been genetic disorders that didn't allow the pregnancy to continue. And you have to know that it was pretty much nature's way. And this is how I describe it to all of my patients, especially for ones where we, have an unknown cause. This is nature's way of dealing with something that could have turned out bad. Now, of course, if I had patients who, had substance use issues and different things like that, and we think that those may have contributed, I'm going to have a discussion with them about that. But I want women to be encouraged to talk to their OBGYN about their feelings, their concerns, their reservations. And, if you are having any, depression, anxiety surrounding this, your miscarriage, these things are very important to, have a discussion about, because of course, it leads to thinking, okay, what's going to happen the next time I get pregnant? Am I going to have to go through this again? As a person to have gone through this myself multiple times, even with having 8 children, it is not easy. It's not easy at all. So reach out to people if you are struggling mentally with it. And it's okay to cry. It is okay to cry. But again, bottom line is it likely had nothing to do with you. So I hope this was helpful to someone out there. Thanks so much, guys. You guys take care. Always like and subscribe. And if you have any questions, please just post them below. Have a good day. Take care.